Come in.
Hi, good morning.
Good morning.
My name is Stacy. I'll be your respiratory therapist today. Who are you to the patient?
I'm her mother.
Oh, it's nice. Nice to meet you.
you.
Okay, so I'm going to talk to you about your lungs and the drugs that you're going to be taking home. I'm going to go wash my hands and I'll be right back. Paulina, could you tell me your name and date of birth, please?
Yes, it's Paulina Grobova, October 22nd, 1993.
Okay, great. I'm going to teach you about a medication called Cerevan. Is there anything that's going to prevent you from understanding what I'm about to teach you? It's really important that you understand this.
No, I should be fine.
Okay, so Cerevan is a long-acting bronchodilator, and it helps, it helps with long-term treatment, helps more oxygen getting to your lungs, which is what we want, right?
Mm-hmm.
So, do you smoke? Okay, that's good. You need to stay away from any triggers. Bless you. Any triggers, anything that is gonna make you or increase the risk of having an attack. And I also want to talk to you about peak flows. Do you know anything about that?
No, I don't.
Okay, so this is a peak flow monitor. And these are called zones. There's a green one, a yellow one, and a red one. Now, ideally, we want to get you into the green zone, which is in the above the 600 range. Your yellow zone is this when you're okay, but you have to be careful and use a lot of caution. Now your red zone is when you have to call 911 or come see us immediately. This is the mouthpiece that you're going to blow, so I'm going to have you test it out and blow as hard as you can. All right. Okay, good. So you're in the yellow range, which is expected because you recently had an asthma attack. Now I need you to monitor your peak flows every single day so that you can and this goes to you as well, mother. You need to make sure you're documenting her peak flows. Make sure yellow to green is fine, but anything closer to red or below red, you definitely need to take action. Okay. Do you understand everything that I said? Do you have any questions so far?
No, I don't.
All right, so let's get to the medication. As I said, Cerevan is a long-acting bronchodilator. The medication Cerevan, it comes in a disc like this. Okay, so you're gonna pull down this way, and this is where the medication is stored. This is where you're gonna breathe from. And you're gonna prepare your dose. In order to prepare your dose, you have to pull down this lever. Okay, all the way down. Do you see the number go down?
Yeah.
Okay, so that tells you the number of doses you have in there left. Okay, so before you take this medication, you're gonna exhale, and you're gonna take in a deep breath, take in all the medication, hold it for 10 seconds, and then you exhale. Okay. Do you understand?
Yes.
Can you demonstrate this for me?
Sure.
All right.
Is she going to get an actual dose of the medication?
Yes, she will. The nurse is gonna come in and give her actual medication. This is just for demonstration purposes.
Okay.
Okay.
So you pull the lever down.
Yes.
To prepare the medicine. Then you exhale. You inhale the medicine and hold it for 10 seconds, and then you exhale again.
That's right. So can you show me?
Sure. So you pull it down. You exhale. Inhale. And exhale.
Very good, Paulina.
Good
So,
job, honey. Thank you.
Paulina, do you have any questions for me?
No, not right now.
Okay, so now it is very important to rinse your mouth with a cup of water after you're taking this medication. This is going to prevent that dry mouth feeling you have when you inhale.
Okay.
All right. So are there any questions you have for me?
No.
Are you sure? You can ask.
No,
Okay.
not right now.
All right,
Do you
so-
have any questions?
No.
Alright, so I'm gonna go ahead and get your nurse and she's gonna actually give you the medication.
Okay,
Alright?
thank you.
Okay, be well.
Thanks.
Bye.
Hi, Paulina.
Hi.
Hi, and you're her mother?
Yes, I am.
Hi, my name is Miriam. I'll be your nurse today.
Okay.
Can you just verify your name and date of birth?
Sure, it's Paulina Goforova and the date of birth is October 22, 93.
Okay, thank you. I believe the respiratory therapist came and spoke to you about your medication.
Yes, you do.
Okay, so I'm just gonna go wash my hands and I'll be right back to administer the medication, okay?
Thank you.
Okay, so I'm just gonna provide privacy. Okay, so do you know what drug you're going to be receiving?
Yes, it's Cerevan.
Okay, so Cerevan is a long-acting bronchodilator that will help you with your asthma, okay? I know these past days have been very difficult for you. Is this a good time for me to do a little bit of teaching and administer the drug for you?
Yeah, right now it's fine.
I just want to ask you if there are any cultural restrictions or limitations, religious beliefs that won't allow you to take the drug as prescribed, such as any holidays or practices.
No, that shouldn't be a problem, right?
No, I don't think so.
Okay, so I'm just gonna give you some information regarding the medication since it is a new medication for you.
Thank you.
And just follow along with me. I'm just gonna give out some instructions, okay, before I administer it.
Okay.
Okay, so the formula is called Salmeterol, but the brand name is called Cerevan Discus.
Mm-hmm.
Okay, so you take this drug twice a day, every 12 hours. The onset of it is 10 to 25 minutes, okay? So, for example, if you would take it at 8 a.m. in the morning, the second dose would be at what time?
8 p.m. at night.
Okay, great. So, what happens now if you miss a dose? So, once you miss a dose, you take the dose as soon as you remember, and you resume the regular schedule, okay? You never take a double dose, okay?
Okay.
Okay, so if you develop symptoms as
I have a question.
Yes.
So if she's having an asthma attack, should she take the Cerevan too?
No, like I said, she can't double dose Cerevan, but she can take the albuterol, the short-acting bronchodilator, in between for an
Okay.
acute asthma attack, okay?
Okay.
Okay, so just keep in mind that she will need to take an inhaled glucocorticoid, such as fluticasone, as she's taking the medication, okay?
Okay.
Do you have that medication?
No, I don't have it.
Okay, so I'll have the physician prescribe it on discharge, okay?
Thank you.
Okay, so,
What are the side effects of the drug?
okay, so since this is her first time using this medication, it is common for something called paradoxal bronchospasm to occur. Some signs and symptoms of that would be wheezing, dyspnea, tightness in the chest, rash, itching. Okay, so if you are experiencing any of those, you should contact the healthcare provider.
And what is dyspnea?
It's like shortness of the breath.
Okay.
Okay. Okay, so what can also happen is you can get a headache. If you start experiencing a headache, this shouldn't prevent you from taking your medication. You should just take something like an ibuprofen to relieve the headache. Okay? So some other side effects will include palpitations, tachycardia, dry mouth, which you can rinse your mouth for that, paradoxical bronchospasm, and tremors, okay?
Okay.
But if you start to experience symptoms such as agitation, chest pain, dizziness, or seizures, you should discontinue the medication and contact the healthcare provider. Okay, is that understood?
Yes.
Any questions? Because that is a sign of toxicity overdose, okay?
Okay.
Alright. Okay, so I'm just gonna do a quick assessment before I administer the medication, okay?
Okay.
Okay, one more question. Do you have any heart problems? Are you on any medications such as beta blockers,
No.
antidepressants? No?
No.
No history of diabetes,
No.
seizure disorders?
No.
Okay, so I'm just gonna do a quick assessment, okay?
Okay.
Can you take a deep breath in and out for me? Okay, so it sounds good. Your blood pressure is 120/80, and your heart rate is 70, and your oxygen is 95, okay? Okay, so I'm just gonna check that I have the right medication and the right dose, and okay? Okay, so I just need you to scan your bracelet.
Okay.
Can you verify your name and date of birth for me?
Sure, it's Polina Gogorova, October 22, 93.
Okay, do you have any allergies, Polina?
No.
Okay. Okay, so I got the right patient. This is the right drug. Dose is correct. Route is by mouth. And at 9 a.m. Okay, Polina, we're ready to give the medication.
Okay.
Can you demonstrate it to me before we administer it?
Sure.
Okay, good job, Paulina. Okay, so I'm just gonna give you a cup of water to rinse out your mouth. Okay, great. So we just administered the medication at 9 a.m. So the next dose would be at what time?
9 p.m.
Okay,
Great job,
Good.
honey. Thank you.
okay. Do any of you have any questions?
No.
No.
Questions? You can just ring the call bell, okay? It's right here.
Thank you.
Okay,
Yes,
so
thank you.
you're welcome. Just gonna document now and wash my hands.